Hey, it's Dr. Jay Calvert, and I am here today with two of our all-star USC residents to talk to you all about lateral support in tip reconstruction and rhinoplasty. And we just finished a case where we were doing a tertiary rhinoplasty, and we had choices of how to really support the lateral aspects of the tip reconstruction. And the problem for this patient was that they didn't really have good support in the first place, and that's why they're here for the secondary, this tertiary rhinoplasty. So there are several choices when creating support. And what I'm going to do is I'm just going to draw first some lower lateral cartilages so that we can kind of see what we're talking about here. So this was sort of her situation. She had some asymmetry. Those are the lower lats. And so the placement of support can come in a lot of different ways. What we did for her was what's called a lateral crural strut graft. And that's when we used some rib cartilage right behind the lateral crura, and we sewed these in really snug. And it goes directly behind the lateral crura. That is a lateral crural strut graft. It is literally a strut designed to hold the lateral crura out at length to support the external valve, and it is also a contour graft as well. The next graft to know, and I'll just draw one lateral crura for this, is a choice that I use very often in primary rhinoplasty, which is called an articulated rim graft. And the reason I like this is because I can do my cephalic trim on the lower lateral cartilage, on the lateral crura, but then when I want to shape the nostril, I can add this articulated rim graft, which allows me to contour the nostril rim and support the lateral crura, and also create any kind of shaping of that lateral crura as it comes from the tip out towards the piriform aperture. So this is a very effective support graft, and it's really great for contouring the nostril and supporting the tip in a left to right manner. So it's nice because it doesn't have to replace the lateral crura. You can leave that naturally occurring beauty and strength of the lateral crura that you have in primaries, but I rarely use an articulated rim graft in secondaries for whatever reason. I wind up doing lateral crural strut grafts and then adding additional rim grafts if I need them, which we're going to get to next, which is the traditional rim graft or alar contour graft, which is more or less a free-floating piece of cartilage that is inferior to the lateral crura. So if the nostril is sitting like this being the nostril aperture, an alar contour graft or rim graft will go right in this position here. And it's just a free-floating graft, and you can see it right there, inferior to the lateral crura. That is a rim graft or an alar contour graft. Piece of cartilage, whatever's left over, little pocket in the vestibular skin, and slide it in there, and it helps you to shape the nostril and support it. Very common. And I will use those also when I've already used a lateral crural strut graft if I still need alar shaping of the nostril. Then last but not least, we wanted to talk about the upper lateral cartilage extension graft, which I use after doing a cephalic trim of the lateral crura. What I'll oftentimes do is if the upper lateral cartilage is here and there's a space, and I'll show you this, in between the upper lateral cartilage and the lateral crura that I think is too big and going to result in pinching. If it looks like that, here's your upper lateral cartilage, there's your lateral crura, you have the space in between. I'll do a little extension graft onto the upper lateral cartilage. And when I sew that in place, what it does is it fills the space, it keeps it from pinching, it can help keep the internal valve open, and it also looks really great because it doesn't let the nose drop in and pinch where there's just basically mucosa, soft tissue, and skin. So those are really the mainstay options for me. For completeness, we'll talk about a batten graft. And a batten graft is really goes in between the upper lateral cartilage and all the way out to the septum, like if here's the septum here, and the piriform aperture. This is also to fill that pinching space for more of a breathing issue. And it goes right in between the upper lateral cartilage and the lower the lateral crura, and goes from the piriform out to the septum. That is a traditional batten graft. So with all those approaches, you can really start to balance your tip aesthetics and your airway, because again, the rhinoplasty is a very functional operation. So you have to manage the airway and the breathing function of the nose while also making it look great. Any questions, you guys?
Crystal clear.
That
That was
answered
pretty
all
good?
of them.
We got it, huh? All right.
That was awesome.
So there you go.